She was very depressed, very poor, actually. She and her husband and 3 kids, before they got separated, were living in one room in her sister's 2-room mobile home. So I just jogged with her. I didn't really have much to offer. I just listened, prayed for her. Then eventually, she and her husband were trying to work out their marriage. We invited them to marriage group. Then we started having their family over for dinner. And they've been in our marriage group now for a couple years. This spring, at one of our meetings, her husband shared his realization that he needs help for his addiction. And as he shared, I just start crying. And except for when I'm public speaking, in which case sometimes I cry, so I hope I don't cry too much today. But I was just crying and I couldn't control it. It's very rare for me to cry in a small setting, in a small group. And my husband kind of looked at me in the group and just said, "What's going on? Can you share with us what's happening?" And I just realized that it really mattered to me. She wasn't just a poor person living in a one room of a mobile home with her 3 kids and her husband. She was my sister. She was my friend. Her pain was my pain. I think Jesus gave me a little bit of his heart that day and continues to, as I still, 2 years later, still get up on Thursday mornings at 5:15 to run with Rosie. I'm so thankful for that friendship because I see Jesus through her. And Jesus allows me to enter a little bit into her suffering. The founder of World Vision said, "Let my heart be broken by the things that break the heart of God." So if your heart is often broken as you try to follow Jesus, give thanks. Maybe you're just where he wants you. If you're not sure at this point what does break your heart, ask God to show you. He will show you. And once he shows you, go there. Go where your heart is broken. Go where you're going to need God. Go where you're at the end of yourself. Where does God specifically want to lead you? Maybe he wants you to invest in a relationship with someone, like Rosie. To just be a friend, to know. Maybe he wants you to pray surrender prayers with your patients, or ask your colleagues to pray for you more often, to let him into your brokenness. Let him into your need. Maybe he wants you to just volunteer in a clinic, serving the poor. Maybe he wants you to start a clinic. Maybe he wants you to give a lot more money away. Maybe he wants you to go across the country or the world. A woman named Shiva, who grew up Hindu, her name actually is a name for a Hindu god. She and I did a talk together at a conference, the Fuller Conference, actually, a couple years ago, on what is poverty. At the time, she was going to kind of a fancy Orange County church, and she was working in, I think, the public health department of Long Beach. I got an email from her a few months ago. I hadn't heard from her in a long time. She sold everything she had, and she moved to Asia to do missions work, to work with young girls in the sex trade. And she has so much joy. She gave it all away. when I was right here at the CCHF conference 6 years ago in Wheaton, I was working in a secular clinic in inner city LA, and I really came for renewal and refreshing. I was kind of tired. And at that clinic, God spoke to me about where he wanted to lead me. I remember being overwhelmed at that conference about how much God loved me, but he also told me he was calling me to something more. I knew I was called to something specific, to be a part of a faith-based movement in healthcare in Los Angeles. Since then, I've been on a journey to follow Jesus through healthcare in Los Angeles and to figure out what that looks like. So I'm going to talk a little bit about my home, Los Angeles. A part of my journey has been trying to understand this huge city. Los Angeles City has about 4 million people. The county has about 13 or 14. This is a picture of Los Angeles County. I don't know how well you can see that, but hopefully you can see what's above it, which is that over 2 million people in my county have no health insurance. Can you even fathom that number? 2 million people in Los Angeles County with no health insurance. This picture was actually sent out by the County Department of Health Services when they were closing down the main county facility for South Los Angeles. I don't know if you can see that, it says South Los Angeles. It was called Martin Luther King Hospital. What happened was, kind of the straw that broke the camel's back there, was that a woman had been brought into the emergency room writhing in pain, and they totally ignored her. In fact, there's video of the janitor sweeping the floor around her. She died that night. And there was such a public outcry about the hospital that they shut down the hospital. But what happened when they shut down that hospital? This part that's highlighted in the picture, and this is still the case today, that they shut down the hospital maybe 3 years ago. There's one hospital for over 600,000 people in South Los Angeles. That's worse than many third world countries. One hospital. I think the most desperate problem in LA County, besides the lack of insurance in 2 million people, and besides the fact that there aren't enough hospitals, especially in South Los Angeles, and I actually live in Paramount, which is next to Compton, which is in the middle of that highlighted box. But what really gets me is the lack of access to specialists. There's little to no access to specialists for people in poverty. I'm just going to tell you 2 stories, and I could tell you so many more. Frank is a man in his 50s with severe heart disease and prostate cancer, who had a heart attack 4 years ago, went to the county hospital in Los Angeles and had a stent put in. Then he had another stent put in a couple months later, in 2007, January. And at that time, they found a severe lesion in another artery. Then he just got lost from the system. Poof. Stopped seeing the cardiologist 4 years ago. I actually didn't even know about the stents and what they found for the longest time after I started seeing him last year, because I couldn't get the records from the county hospital. I just knew he had heart disease, but I didn't know how bad it was. Not only that, he had prostate cancer at the same time, so they didn't operate because of his heart, and they gave him some radiation. I still haven't gotten those records. Lost from the system. So last year when he comes to see me, he's having all this chest pain. His numbers for his prostate cancer are starting to creep up and up and up, and I cannot get him an appointment. He finally got in with one cardiologist who did a preliminary test which was inconclusive. So what did they do? They gave him a follow-up appointment for August, when his preliminary test was in January. I still cannot get him into a urologist, a prostate cancer specialist. I've been trying for a year. I think maybe a little over a year. Emma's a 59-year-old woman with hard-to-control diabetes, hard-to-control blood pressure, worsening kidneys, not unlike a lot of our patients, I'm sure. 1 week to the day after Eric, the 35-year-old, died in our parking lot, I heard the news that Emma was found dead in her home. I had only seen her a few times. She'd seen one of my partners, but I started to look through her health history. I saw she had an abnormal EKG a couple years ago. She didn't go to the cardiologist because she had already had experience trying to get into the county system of specialists. She couldn't afford it. It took too long. She just didn't want to mess with it. And she didn't have chest pain. So she never went. I wonder, had Emma had access to a specialist a year or two ago, would she be alive today? Another part of my journey, trying to follow Jesus, has been trying to love my own neighborhood, which is my hometown of Paramount. Paramount has about 55,000 people. Over 30% of the adults are uninsured, so that's about 16,000, 17,000 people. It's a lot of people. For about 10 years, I've just been trying to get to know the neighbors in my neighborhood. So we have a little team of volunteers. We go, we check blood pressures, we check blood sugars, we educate people. We pray with them sometimes, and we refer them to local doctors, to one of the few community clinics that exists sort of nearby. It's not what I'd like to have. I'd like to have more of a full-fledged clinic there. But it is loving the neighbors in my neighborhood. Rochelle helps with that. After the CCHF conference in 2005, I thought, maybe I'm called to start a clinic in Paramount. So we kind of looked into that. But then, as our church began to look west, I began to look west also, to the city of Compton. You guys have already heard a lot about Compton from me, but there's about 100,000 people in Compton, and about 28 to 30% have no insurance. So that's 25 to 30,000 people who have no insurance in Compton. There are two branches two kind of small branches of a federally qualified health center in Compton. I worked at one of those for a couple years before I went to Los Angeles Christian Health Center. They're very busy, very overcrowded, not in any way affiliated with a local church, very secular. And they see maybe 5,000 to 7,000 of those patients per year. Every day we turn so many people away from that clinic. There's definitely a need in Compton. I'm blessed now to be, for the first time, in a faith-based clinic where we can address people's spiritual needs and physical needs, but it's 15 miles away from Compton in East LA. This is not the success and achievement story maybe you were hoping to hear today. I can't tell any great stories about Hope Health Center Compton. It doesn't exist yet. But maybe God's asking me to surrender my need for success and achievement and just say, lead me, God, thy will be done, but it's in your timing. So wherever you are on your journey, if you see that you're not enough, if you're willing to surrender and follow Jesus, this is the third thing I want you to write down. Jesus is enough. You see, Jesus didn't say he was enough to the rich man, because the rich man walked away. He walked away before he had a chance to surrender, to follow Jesus. But look what Jesus says to his disciples, who say, Jesus, how can anyone be saved? If you're saying, no rich man can get into heaven, what's going on here? Jesus looked at them and said, with man, this is impossible, but not with God. All things are possible. And Peter spoke up and said, we've left everything to follow you. And Jesus says, truly I tell you, no one who has left home or brothers or sisters or mother or father or children or fields for me in the gospel will fail to receive 100 times as much in the present age. Homes, brothers, sisters, mothers, children, fields, along with persecutions. Notice how he stuck that one in there. And in the age to come, eternal life. I think Jesus wants us to know today, because you've heard a lot about suffering. You've heard a lot about entering into people's brokenness, people's pain, laying it down, laying down our agenda and following Jesus' agenda? I think he wants me to know and you to know that he is enough.